Nurses picketed outside NewYork-Presbyterian Hospital's Columbia campus on Monday, launching what union leaders called the largest nurses' strike in New York City history.
We are participating in the historic largest nurses strike in New York City today, and we're doing that because we're advocating for our patients, for better care and safety while they're in the hospital.
Registered nurse Stephanie Michelli said the walkout was about protecting patients and demanding safer conditions inside the hospital. Nearly 15,000 nurses across multiple hospitals joined in the strike, filling sidewalks with chants and signs as supporters waved from overhead walkways.
It is so important for us to strike as nurses because we do not have enough support. We do not have enough nurses. There's too many patients. There's not enough nurses. We are spread so thin. I want to spend more time with my patients. I want to be able to be at bedside, but I can't because I'm running around from room to room to room to room. And it's not enough. We need more support. We need more nurses.
Registered nurse AJK said chronic understaffing has left nurses overwhelmed and unable to give patients the attention they need. Outside the hospital gates, nurses danced and chanted, trying to keep morale high despite weeks of failed negotiations.
Every day, my team, we are in the ICU. We are working with some of the sickest patients, not just in New York City, but in the country. This is one of the most acute ICUs in the country. So we are running. From post-procedural to patients who just have had coded or have had a rapid response, we are constantly running to the point where sometimes we don't even get to take a break.
Michelli, who works in intensive care, said the pressures inside the ICU is constant, with nurses racing between emergency and often missing breaks. Ambulances continued to arrive and depart as the protests stretched along Fort Washington Avenue.
I work in the ED. It's very hard because as much as we want to make sure that every one of our patients are being taken care of, you gotta give us the resources, the favorable condition, actually safe conditions, especially in the ED. It has to be safe because we are facing, workplace violence, not only with staff, but also with patients. We don't know what's coming in, so we want to make sure we take care of you very well.
Emergency Department nurse Karzina Espinoza said unsafe staffing levels are putting both workers and patients at risk, especially as violence in hospital becomes more common. Some nurses held signs criticizing hospital executives' pay, reading, "They get millions, we get pizza."
In the operating room, I work as a night nurse, and we're always short on staffing. And this is unsafe for the patient.
Operating room nurse Michael Lazar said staff shortages are routine on night shifts, creating dangerous conditions for surgical patients. Placards reading "Quality care for all" and "More nurses, fewer millionaires" lined the pavement.
I am fighting for my health care insurance. I don't know how I can be here working at a hospital that will not give me health insurance. It is so important for me to have health insurance. It's so important to take care of the community. I love being a nurse. I want to take care of patients. I want to be at bedside. And it's so important for us to strike because we are fighting for patient safety.
AJK said nurses were also fighting to protect their own health insurance, calling it unacceptable to work in a hospital without reliable coverage. Chants of "We can't take it anymore" echoed between buildings.
We're fighting for a fair contract, safe patient staffing ratio so that our patients can get the best care possible, and also for our health benefits, because if we are not healthy enough to care for you, then you guys have no one. We need to be healthy too.
Michelli said nurses are demanding safe staffing ratios, fair contracts, and health benefits so they can continue caring for others.
When we negotiate, they don't want to meet us or hear our demands. So they think we're greedy, but we're not. We all just want safe staffing, that's all. Fair contract, that is all.
Espinoza said hospital management has refused to seriously engage in negotiations, despite nurses asking only for safe staffing and fair treatment. More signs appeared above the crowd. "Safe nurses equal safe patients." And "Union busting is so disgusting."
We're fighting for the safety of the patient to give the best quality health care and for a fair contract and health benefits.
Lazar said the strike is about securing both patient safety and dignity for healthcare workers. Another sign summed up frustration. "We need more nurses, less millionaire execs."
I'm here for my patients because you can't put patients first if you put nurses last. Okay? Every patient deserves a nurse that is dedicated to their care, is not split between unsafe assignments, split between too many patients. Every patient deserves to have a nurse who is able to take care of them to the best of their ability. And we cannot do that right now.
Micheli said patients cannot come first and when nurses are overworked and assigned to too many cases to handle safely. Messages reading "Patients over profits" and "Safe staffing saves lives" stretched across the hospital frontage.
We want safer staffing ratios because it is more safe to have less patients per nurse because we can spend more time and more attention and more thoughts to each patient as a nurse. And when there's too many patients to one nurse, we can't give quality care. The hospital wants quantity, nurses want quality.
AJK said hospital administrators focus on the number of patients treated while nurses are fighting for the quality of care delivered.
For too many of the 15,000 NYC nurses who are on strike, they are not able to make their ends meet. They are not asking for a multi-million-dollar salary. What they are asking for is for their pensions to be safeguarded, to be protected in their own workplace, to receive the pay and the health benefits that they deserve. New Yorkers have a right to quality health care, as do the nurses who provide that care. My job as mayor is to protect both of those rights. All parties must return immediately to the negotiating table and not leave. They must bargain in good faith. That allows the nurses who work in this city to live in this city. It's an honor always to be your mayor and to have this table. It is time for us to recognize the work that you put in on a day-to-day basis. That we see the work that you do, we believe that work should be recognized, and we stand here alongside you in the fight for that. That you do. Thank you.
New York City Mayor Zohran Mamdani joined the nurses, saying thousands of healthcare workers are struggling financially while asking only for fair pay, pensions and benefits. He urged both sides to return to the negotiating table and reach a deal that allows nurses to live in the city they serve. The mayor spoke at a press conference near the protest site. Mamdani said the city recognizes the nurses' daily work and stands with them in their fight for fair treatment. He later embraced New York Attorney General Letitia James as the event concluded. One nurse held a sign up asking passing drivers to honk in support. Cars responded with loud honks as ambulances continued to move through traffic. As the day wore on, nurses kept chanting and holding their signs. A nearby truck flashing a message in support. Support nurses on strike.